Overwhelmed hospitals, empty pharmacies, morgues and crematoria stretched beyond capacity. These scenes of the COVID-19 outbreaks tearing across China paint a desperate picture. A doctor at a Shanghai hospital says staff are struggling to keep up amid surging demand and unpredictable policy shifts. To protect her identity, she asked not to appear on camera and to have her voice distorted.
病人越来越多，就是一天比一天多的感觉。因为现在医院也没有一个很完美的方案去概括所有的问题，就是每天的政策都在改变。
All this defies the official figures. Since abruptly ending years of harsh zero-COVID measures earlier this month, the government has reported daily deaths in the single digits. A virologist at a Hong Kong university says they're manipulating how cases are counted in order to minimize the crisis. She asked that we also take steps to protect her identity.
They have a system where they only count any death which has respiratory failure as the cause of death on the death certificate. This is in stark contrast to an opposition for the United States, which, for instance, is any situation where the SARS infection was likely to lead to death. I would calculate that the United States would have about 75,000 COVID-19 deaths using China's criteria. The actual number is 1 million there.
The government's sudden about-face on COVID came after nationwide anti-lockdown protests. But the extent of the current outbreaks, this expert says, shows COVID-0 had already failed at this point.
It is very clear that the outbreaks had already been going just from the numbers, and as for how plausible it is, not at all. We're still in the relative early days. There's always a time lag between cases and deaths. But if you just look at just any of the articles, you have crematoria working 24/7, backed up with days. The bodies in the refrigerator trucks in the middle of the street, stuff like that. It is completely implausible, and just based off of everything that we know, primarily from Hong Kong, it's going to get worse. By the time this peters out, we'll expect something on the order of 1 to 3 million.
Earlier this year, once COVID-free Hong Kong saw its death rate top the world when the virus finally slipped through the cracks, decimating the under-vaccinated elderly population. Experts see the same tragedy now replaying in the mainland.
Then China resisted having mRNA, and China did not spend a lot of effort on vaccination of old people. Instead, they spend too much effort on PCR. So a lot of observers already point out the cost of PCR almost equal to the cost of vaccination. Why not vaccine old people first? But you can see that China did not do that.
These images emerging from China almost all come from the country's biggest and most developed cities. The situation in smaller cities and the countryside may be far worse.
China's healthcare system is very unequal. If you go to Beijing, they have so many good hospitals. Then if you go to Shanghai, also not so bad. But if you go to third-tier cities or like rural areas, it's different situation. Rural areas, if you call ambulance, they will not come to you within 1 hour. Even sometimes they will come to you within 2 or 3 hours. It's impossible to handle some emergent cases.
As the wider world moves on, China's opening up bookends the long and tragic story of this pandemic. And it is ending much as it began in Wuhan 3 years ago, with the rest of the world anxiously looking to China and wondering what is really happening on the ground. Ryan Kilpatrick for TaiwanPlus.